Good morning and welcome to Comet Corner. This is a virtual series created by the UT Dallas Office of Research and in partnership with the schools across our campus to host chats with some of our notable alumni to hear how they have taken their research out into the world and made an impact. My name is Enrica Ziller, Research Education Programs and Outreach Manager in the Office of Research at the University of Texas at Dallas. As we move through today's session, I invite you to post questions into the chat for our guest speakers to discuss. Here to guide our conversation and introduce our distinguished alumnus is Dr. Mehrdad Nourani, Professor of Electrical and Computer Engineering and Associate Provost at UT Dallas. He received his PhD in Computer Engineering from Case Western Reserve University in Ohio. Dr. Nourani has been on the UTD faculty roster for almost 22 years, and his research interests include wearable devices, alert systems, and personalized data analytics for monitoring various medical conditions, such as pressure bed sores, epileptic seizures, heart attacks, sleep apnea, and hydrocephalus. Dr. Nourani, welcome to Comet Corner.
Thank you very much, Enrica. Hi, everyone. I'm very pleased to introduce to you one of our outstanding UT Dallas alumni, Jamie Wright. Jamie graduated from UT Dallas with a bachelor's degree in molecular biology in 2010. She is currently in her final year in medical scientist training program at the University of Texas Health Science Center in Houston. She's not only doing the medical degree, but also she's working for her PhD work. In her PhD, Jamie is studying the role of mutations in two genes, ACTA2 and PCNT, in the pathogenesis of atherosclerotic disease. These diseases are the ones that cause fat, cholesterol, and other substances built up in artery walls. So her work eventually would be very useful for exploring the remedies for cardiovascular diseases. Following graduation this semester, so she's going to be very soon PhD MD. Following graduation, she will go on to residency training in adult neurology in University of Washington, where Jamie plans to focus her practice on the management of cerebrospinal fluid disorders. Jamie, it's great to have you here, and we are very excited to welcome you back to UTD, and I really appreciate your talent and your time that you would like to share with us today.
Thank you so much for the kind introduction. Hi, again, my name is Jamie. I'm honored to have the opportunity to talk to you today. So this talk's going to be a little different from my usual scientific talk. I'll tell you a little bit about my PhD project, but also I wanted to focus on the topic of facing adversity during graduate school. I'll be telling you a little bit about some of my experiences with adversity during graduate school and how I got through and kind of what got me through them. So to start off with, a little bit about the MD-PhD program. For the combined MD-PhD at UT Houston, where I'm at, we do the first 3 years of medical school, followed by the PhD years, and then the last year of medical school. So during the summer before starting medical school, and then between my first and second year, I rotated through 3 different laboratories. One of them just wasn't a great fit for me. It happened. So I went on and rotated through another laboratory, and unfortunately that one, the primary investigator left. So I did a 3rd rotation. It was a great lab. I really enjoyed it. I planned on, the PI and I got along very well. I planned to join the lab, and it was a project I was really interested in. And then about a year before I planned to join, so during my 3rd year of medical school, I found out that he was also leaving the institution. It was discouraging, to say the least, but with the support of mentors in the MD PhD program, I kept going and eventually found another laboratory. So I joined a lab studying the role of RE1 silencing transcription factor, or REST, in medulloblastoma, and started a project using an inducible mouse model to study cerebellum development and then the development of the brain tumor medulloblastoma. Then a year into the project, a large grant fell through and the lab essentially ran out of funding for my project, and I was forced to find a new lab. I'm not gonna lie, it was very discouraging, and I did consider quitting the PhD, but thankfully some great mentors in the MD PhD program stepped in and helped me through the process of finding a new laboratory. And so I switched gears a bit and joined a laboratory studying genetic mutations that predispose to vascular disease. So for my dissertation project, I'm studying a rare genetic disorder called Majewski osteodysplastic primordial dwarfism type 2, or MOPD2. It's an autosomal recessive condition caused by mutations in the centrosome scaffold protein paracentrin. These patients have a very distinct clinical presentation. It may be hard to tell in this picture, but these individuals only grow to be about 100 centimeters or 3 feet tall. They also have a small brain size called microcephaly with normal to near normal intelligence and have some bony abnormalities. Interestingly, though, the primary cause of morbidity and mortality in these patients is actually vascular disease. So up to half of these individuals develop Moya-Moya disease, which leads to early onset strokes, and or they develop cerebral aneurysms. And they also have a high rate of very early onset coronary artery disease, leading to myocardial infarction or heart attack, in addition to other vascular pathology. So to study this, I used a mouse model in which paracentrin was knocked out specifically in vascular smooth muscle cells. It was an inducible model, so I isolated vascular smooth muscle cells from the aortas of the smooth muscle cell specific paracentrin knockout mouse. And one of the first things I did was assessing their proliferation with a BRDU incorporation assay, which labels the proliferating cells. So at baseline, there is not a distinct difference between the DMSO treated control cells or the tamoxifen treated knockout cells. But when we treated with the smooth muscle cell mitogen PDGFBB, which induces proliferation, we saw a significant increase in proliferation of the knockout cells. This was very surprising considering that all the leading hypotheses for the pathogenesis of MOPD2 are centered around a reduction in cell proliferation, considering these patients' abnormal growth. So it was very surprising to see an increase in proliferation in these cells. So this led me to look into potential mechanisms for increased proliferation, which brought me to paracentrin's role in the ATR-dependent checkpoint regulation pathway. In response to cell stress, such as hypoxia or mechanical stress or other stressors, ATR activates CHEK1, and then activated CHEK1 is then recruited to the centrosome by microcephalin and paracentrin. Once inside the centrosome, CHEK1 deactivates CDC25B through phosphorylation, leading to a resulting increase in the inhibitory phosphorylation of CDK1 cyclin B. And this results in G2 to M cell cycle inhibition. So my hypothesis centered around that in the absence of paracentrin, CHEK1 would not properly localize to the centrosome, meaning that in the absence of paracentrin, we would then be increased activation of CDK1 cyclin B, leading to increased G2M cell cycle progression or abnormal cell cycle progression, leading to smooth muscle cell proliferation and occlusive vascular disease, such as that seen in patients with MOPD2. So while pursuing this hypothesis, we obtained coronary artery tissue from a 25-year-old patient with MOPD2 who died of myocardial infarction or heart attack. So as I mentioned, these patients have very early onset coronary artery disease. These are images from the left anterior descending coronary artery from this patient. The first row is a Movat stain or a pentachrome stain, and it very nicely shows all the different layers of the cell wall. So this is the lumen. As you can see, there's a large plaque here, and then this is the lumen that's left over where the blood is actually able to flow through. Looking at a higher magnification, you can see the cholesterol crystals, and then we have our innermost internal elastic laminae, and then the medial layer, which would normally have these pink or red stained smooth muscle cells, which you can see are absent in this patient, and then the external elastic laminae and adventitial layer, or the outermost layer of the artery wall. This is an H&E stain showing the same thing. So normally we'd have these blue stained smooth muscle cells, which are lacking in this patient. We also see the cholesterol crystals, and then we see more cells than would be expected in the adventitial layer. And we confirmed that these that we are lacking the smooth muscle cells using a smooth muscle alpha actin stain or an SMA stain. And it's hard to make out the wall here, but this is the medial layer where we would normally see a lot of this brown staining of the smooth muscle cells, and it's lacking in this patient. Now, if you look at the lower magnification image, you do see some smooth muscle cell staining in the adventitial layer, which is where we would normally expect it, and then also in what we call the fibrous plaque, or the fibrous cap of the plaque. So based on these findings, my project has shifted directions from focusing on occlusive vascular disease to studying the atherosclerotic disease seen in these patients. A recent paper from our laboratory showed that exposing smooth muscle cells to cholesterol, as shown here, activates several of the ER stress pathways, including IRE1, PERK, and ATF6. And this PERK activation activates ATF4, which then activates KLF4. And the two interesting results of this is that we get downregulation of the contractile proteins in the smooth muscle cells, and then upregulation of macrophage and fibroblast markers. And this is what we term modulated smooth muscle cells. And these modulated smooth muscle cells go on to contribute to atherosclerotic disease pathogenesis. And looking at these pathways in my own smooth muscle cell specific paracenterin knockouts, we've found similar findings in these cells, which we are now investigating further. Kind of along with my graduate school work, I've had several life interruptions along the way, and those have been mostly in the form of being a patient, spending a lot of time on the patient side of things. So I was born with a condition known as hydrocephalus. The brain is normally cushioned by what we call cerebrospinal fluid, which is kind of like water that surrounds the brain and then is also inside these ventricular spaces called the cerebral ventricles. You see here the lateral ventricles, third ventricle going into the fourth ventricle. And in hydrocephalus, the flow of this fluid is disrupted either by a blockage, too much fluid being produced, or not enough fluid being absorbed. This leads to enlargement of these ventricles, resulting in pressure on the brain, which, as you can imagine, is not good for it. So the most common treatment for hydrocephalus is a device called a shunt. It consists of a long tube. So there's a tube that goes through a burr hole in the skull into the brain, into those cerebral ventricles. And then it connects to a valve device, and then another long tube that drains either into the abdominal cavity or into the heart. It seems like a pretty simple device, but shunts actually have the highest failure rate of any implanted medical device. In children, about 50% of shunts fail within 1 or 2 years of being placed. Another possible treatment for hydrocephalus in some individuals is something called an endoscopic third ventriculostomy, or ETV. In this procedure, they use an endoscope or camera to go down through the brain into those cerebral ventricles, and they go down into the third ventricle and make a new opening for the fluid to flow through. So these are actual images from a video of an ETV procedure I had done in 2016. The first image, this is inside my cerebral ventricles, and then this was looking down at the floor of the third ventricle, where they then made an opening for the CSF, or cerebral spinal fluid, to flow through, and here you can see that hole where the fluid flows through. So in the spring of 2015, during my first year in graduate school, I had a shunt malfunction, my first one in about 10 years. That unfortunately was followed by another malfunction and another, and I continue to have problems. So I had something called intracranial pressure, or ICP monitoring, where they put a wire down through an opening in the skull into the brain and monitor the intracranial pressure. And based off of those results, we decided to externalize my shunt. So here, the cerebrospinal fluid is draining into a bag by my bed. So there's actually like a tube going to this bag. And I had an endoscopic third ventriculostomy procedure where they used the camera to go into my brain that I showed you the pictures from. But unfortunately, that didn't work for me. So I had another shunt revision, which a few months later was followed by another shunt malfunction and another revision, more ICP monitoring because of continued problems, another shunt revision, and then finally I went to the University of Washington for intracranial pressure monitoring there. So in total, I had 11 hydrocephalus-related neurosurgeries during graduate school, in addition to frequent shunt setting adjustments and daily migraines. It's definitely been a challenging journey, to say the least. It's hard being on the patient side of things. You know, some people could say it's a full-time job. It keeps you very busy. It's, you know, a lot more than just the treatments itself. But there's, you know, in addition to that, there's a lot of stigma, both in research and in medicine, for students with chronic health issues and disabilities. Graduate school can be very unforgiving, and I was several surgeries in before I finally reached out about accommodations. And now I encourage other students who are struggling with health issues to definitely reach out early and start those conversations with the accommodations offices. In addition to the accommodations office and the people in my school, I also had a great support system during all of this. So while I was actually a student at UT Dallas, I first met and talked to somebody else with hydrocephalus in a shunt. And that experience inspired me to get involved with the Hydrocephalus Association. And in 2012, during my second year of medical school, I started the Houston Hydrocephalus Association Community Network and helped organize the Houston Walk to End Hydrocephalus. So this is actually a picture from December 2019, our annual holiday party, before the time of COVID. That's why nobody's in masks. And then this is actually an early picture. So this little guy is actually about 7 years old now, and it's been wonderful. I've gotten to watch him grow up through the years. So this is just some of my hydrocephalus community. And some of my greatest friendships and support has come through this community. In addition, I have my friends in the MD PhD program and my wonderful healthcare team. This is actually my neurosurgeon at the Walk to End Hydrocephalus in Houston, and then some of the care team from the pediatric neurosurgery clinic where I received care. And then last, but certainly not least, my wonderful family. I have another sister who wasn't able to be here in this picture, who's actually up in Seattle, so I'll be living near her. But especially my mom, you know, she's made many trips across the state to come be with me during surgeries and hospitalizations. So, definitely don't try to go it alone and have that support system. And then, as mentioned, on March 19th, I found out I'll be starting neurology residency at my top choice program, the University of Washington in Seattle. In addition to being a leader in neurology, they're also one of the few places in the country with a clinic dedicated to patients with hydrocephalus and other cerebrospinal fluid disorders. They are actually who I went to for another opinion regarding my own hydrocephalus care. As I saw one of those pictures, was actually ICP monitoring being done at, through the University of Washington. And my goal is to specialize in the management of hydrocephalus and other CSF disorders and to utilize my PhD training to conduct clinical and basic science research on hydrocephalus. So in conclusion, this definitely has not been an easy journey. And there were multiple times along the way that I doubted my ability to finish. But finding that supportive mentors and finding that support system is absolutely crucial. Along with reaching out for help when needed. Graduate school and medical school are hard, even without the various complications that it can arise, and it's very important not to go it alone.
Wow, Jamie, thank you very much for sharing your professional as well as your personal story with us. What a journey you had. I really enjoyed your presentation, Jamie. Thank you very much. You have given us a lot to think about and to ask. Of course, I have done a little bit work on hydrocephalus shunt on the engineering side, but I don't want to kind of bring those issues too much. I'd like at this point to invite Dr. Shalini Prasad to join our conversation. That we together can ask maybe more questions and then, hear your experience more. Dr. Prasad is Cecile and Ida Green Professor and Department Head of Bioengineering and Biomedical Engineering in UT Dallas, perhaps one of the youngest departments in UT Dallas. Dr. Prasad's research are multidisciplinary, and her current research interests focus around health challenges of rapid and cost-effective diagnosis for various diseases such as cancer, neurodegenerative diseases, and cardiovascular diseases. Her research lab is very active in developing translational technologies for affordable molecular diagnostic platforms. Of course, in her role as department head, she knows a lot about graduate students, the difficulties of graduate students, as well as undergrads, I assume. And before I kind of give her also a chance to say hi, let me congratulate her also with the excellent news that she heard and we heard yesterday or today, that based on US World News ranking, the ranking of bioengineering department has jumped higher by 10 levels this year. Congratulations, Dr. Prasad. I just give you a little bit chance to kind of say hi to Jamie, and then we take the conversation with Jamie from that point on.
That's great. Thank you so much, Dr. Nourani. That's yes, we are so excited to have Jamie join us. And Jamie, I think the point you made, the sense of community, building the community and the support system is probably the biggest driver to deal with any adversity in life. And I truly wanted to reflect on that. So I wanted to just take a little bit of an opportunity to perhaps talk a little bit on facets that require us to build a sense of community. I am a South Asian immigrant and a female faculty member. There are not that many of us in academia. And so when we do this, most often what is not recognized is there are two things that impact career growth in academia. One is the whole immigration that drives that. And the second thing that drives this is the dual career aspect, because more often than not, all of us do get married to people who are like-minded and hence most often have very advanced careers. So the thing I have learned is awareness is important, followed by education, and finally advocacy to help build a network towards helping us out. So I'll take probably a minute or two to just talk about that, my story per se, so that we can have this great conversation where we want to hear more about all the things that you've had to do, Jamie, to kind of make this such that we can internalize as well as externalize the impact we have for our community. So for immigration, and I wanted to just kind of touch about that, is most often international graduate students, we have a very clear path to immigration. You have to start as an F1 student with an F1 visa, be a student, followed by an optional practical training at which you're going to find the job. So in my case, it was being an assistant professor in Portland, Oregon. So followed that by H-1B visa, which is your work visa that allows you the ability to immigrate to the United States through a permanent residency petition. And if all of this is successful, then you can become a permanent resident, followed then by naturalization, should you do that. So for me, that cycle was 18 years from the time I started as a graduate student in University of California, Riverside. I hit a road bump in 2010, in April of 2010, when I had just given birth to my first son, and he was barely 3 months old, when my petition to for my permanent residency got denied. And so, unfortunately, the way H-1Bs are set up for academic jobs, you have to find an equivalent academic job for you to continue to stay legally. So while you fight the legal battle, you got to figure out how to stay legally in the country. So, again, a quick primer, academic jobs, they get posted in the fall semester. You get to apply, and you basically, decisions are made by March, April. So in April, if you're looking for an academic job, it's like finding a snowflake in July. So, of course, I was lucky enough to find 2 jobs, one in Wichita, Kansas, and the other here at UT Dallas. Applied to both. I got to interview at both. Unfortunately, UTD didn't have the money to make me an offer. So I had to go to Wichita, Kansas. And the decision we made as a young family was that I would fly out every week and my husband would stay with our son. So we had family, luckily, coming to support us, as well as we have the resources to be able to hire a nanny to help us out as well. So while all of this is happening, getting on a plane, and there's no direct flight. So you have to fly Denver, Wichita from Phoenix, or Houston, Wichita. You do this back and forth with bags and bags of breast milk. It's not fun. It gets old pretty quick. But the point was my husband could not find a job in Wichita, Kansas, because he was in semiconductors. So this is where, you're truly challenged. You have a dual career. What do you do? So I had to tell my department head then, by the way, I just got here, but I'm going to look for another job because we just can't make this work. So now imagine being on a career, like a job trail again, and there are so many red flags. Nobody looks at your CV and says, oh, this is great. Oh, why is this person trying to change a job? There has to be something wrong in them that they're doing this. So we are generally judged by our CV. No one looks at us beyond our CV or our resume. And this is something I feel very strongly about. In fact, as you rightly said earlier, you don't want to make too much of a fuss. You don't want people to think of you differently. That's the same thing, right? So you don't want people to think of you differently. So you don't want to say anything. You don't want to say, oh, but my husband also needs to be here in the same place. We want to be living in the same house. You have to make accommodations for us because I need to be able to, be able to express breast milk at different times of the day. So these are things you don't want to say. And when you're back on the job trail, the imposter syndrome is huge. Why really do you want to be doing this when clearly you're not very good at it? And it has been said to me directly. It's been said to me, through perception. So it really very much matters, on who believes in you. So for that, I have to say, there were 3 men at UTD who did believe in me. The previous provost, Dr. Wildenthal, Mark Spong, our previous dean, and the department head, Dr. Vidyasagar. They believed in me that a year later, they came back and said, hey, we'll make you an offer because we believed in what you could do for bioengineering. And so that's why I am here. And that's why this is home. There's a lot more we have to do. And as you rightly said, educating people and advocacy is the way to go. But this is all about you, Jamie. So we would love to hear more about your advocacy. How do you get people to think more about hydrocephalus? It's not something that's commonly known to us, right? So how do we get people more engaged? How do we get them committed to learning about this and interacting on this. So please, could you tell us, Jamie?
That's a very good question, and it's something that I've been exploring a lot over the last few years through my role with the community network and with the Hydrocephalus Association. And I think a big part of it, at least for me, has been sharing my story. I've been very vocal about my experiences on social media and sharing my story through pretty much whatever avenue I can. So doing some articles with the medical school and UT Health and that sort of thing. One of the things that really opened some doors and got some people interested in hearing more, I did a medical mission trip with my neurosurgeon to Haiti in 2014 and 2015. And, I ended up doing an article series through the Hydrocephalus Association. So a little bit of preaching to the choir, but, that also got shared in other avenues as well, bringing to light not only the issues of hydrocephalus here in the United States, but also in underdeveloped countries like Haiti, where they don't have the access to care that we have here. When I went, there was no trained pediatric neurosurgeons in the entire country. And so they were dependent on groups like ours coming to care for these individuals. And, hydrocephalus, when a shunt fails, is an emergency. Luckily, I'm right here currently in the Texas Medical Center, the largest medical center in the world. I have access to scores of neurosurgeons just down the road. One of my shunt malfunctions, I went from working in lab to the neurosurgical ICU to emergency surgery in a matter of 20 hours. And, that's something that people in these other countries don't have access to. And it's part of my motivation to get the word out and get more research done, because we definitely need better treatments that don't fail as quickly. And so, a lot of that's been sharing my stories and sharing the stories of other people I've met through the community network. A lot of networking and just trying to get the word out however I can, because that personal story and that personal impact really does make a difference.
Jamie, if I may ask, when I look at my own graduate students, I see that their attitudes toward research, their goals are different. Not everyone thinks the same way. You made a few choices that are really interesting to me. For example, the last one in your professional studies was to decide to have PhD, MD. You didn't need to do PhD. You could just continue with, MD and finish the medical school. That tells me that there is a flair somewhere it was created in you to get to know more in-depth reasons of different things, right? And that's why you kind of wanted to mix these two. Even I looked at your short bio and I saw that even during your bachelor in 2009, I believe, I don't know if that was the first one or maybe you got a few of those, you had research experience in UT Southwest under Green Fellow. So you see, why did you make the choices? How did you think about the research? How did you define the research? How did you find out? Was this just pure curiosity or was other flares? And it's really important for us as professors because we want to encourage our undergrad, our graduates to know research and to think if that is a passion that they can develop over time. So what was it?
So really, it's because I'll be completely honest. When I started undergrad, so at UT Dallas, I'm the first person in my family to go to medical school. I'm the first person to pursue a PhD. And so neither of those were really on my radar. It was actually a seminar that I went to about PhD and MD PhD programs at UT Dallas that kind of planted the seed and got me interested in investigating it further, because I hadn't even considered it. And, that was something where I was thinking a lot about what I wanted to do with my career. And, some assignments and some work I was doing for a communications class had gotten me thinking more about the hydrocephalus and, what attention needs to be to that and what difference I can make in that arena. And so I went to the seminar and they started talking about PhD programs and MD PhD programs, and I was, didn't know much about either one until then. And so, one of the things I did after that is I started reaching out for research opportunities. So I actually my first research experience was in the lab of Dr. Bart Britma at the Center for Brain Health. And I worked with him for about 8 months on a project. And then I was accepted to, after that, I heard about the Green Fellowship Program for UT Southwestern, applied for that and was accepted into that and started work in a developmental biology lab there. And it was great because I found a mentor who, heard about my interest. I told him about my interest with hydrocephalus and patients with hydrocephalus, and he kind of leaned onto that and created a project that really was unique to that interest and focusing on perinatal brain injury, which is one common cause of hydrocephalus. And so, having somebody who's really fostering my interests and working with me, and just a fabulous mentor, really gave me a lot of opportunities. And I ended up working in that lab through the rest of my undergrad. And then I did a gap year before applying to medical school because I was a little late deciding. It was the spring of my junior year of undergrad that, I first realized that I could do this. I could both be a doctor and do research and really come at it from the side of patient care and also studying, how these conditions develop and what can we do about it.
Very interesting. Thank you very much, Jamie. Dr. Prasad, you gave us also a little bit of your experience on that side, which was really, important. Sometimes we don't see the side that maybe female students or female graduates go through. Now, this is a question for both of you. Do you think that during especially master's and PhD in engineering, I know that, you work much more, Dr. Prasad, on engineering side, but do you think that our approach for providing resources or programs, plans, to entice more female engineers should change? Our planning should be different. We can do more. What are your views? And this is, of course, correct also for other areas too, I assume, because, for example, the STEM area, I can ask the same questions about STEM rather than engineering. I'm just curious to kind of hear what are your experience and your views? What could work, or you have seen that worked well, and what perhaps can improve?
So building, I think, a diverse environment, right? For an environment that this demonstrates access and enables diversity is generally the challenge any academic educational institution, especially more so with STEM, which requires everybody to be able to do a lot of bench work or a very intense computing work that requires significant number of hours we do have to dedicate towards doing that task because it is designed in that manner. So one thing I have observed in the years I have done both graduate program direction as well as now with the department is that it is not so much the lack of commitment, but there's a big leaky pipeline for women, right? So it is just the age and stage in life that we are in, right? So ultimately, childbirth is something that is, it's just a woman's domain. She is giving birth to the child. And along with that comes the added responsibilities, both from a mental health as well as a physical health standpoint. Even today, I mean, it is true when suddenly a graduate student might come to an advisor and say that they're going to have, they're going to give birth to a baby soon, right? So then how do you make sure that the environment now supports the student such that the student can do that and then come back to research work? So there is going to be a hiatus in the career. How is that not going to be detrimental when that career is viewed? But at the very beginning of the life cycle is attracting the students. So do we have people who look like the students we want to recruit? Because I want to go to a place where there are more like me and it is welcoming. So this is something I think we are all working at UTD to make that environment inclusive and accessible. And I think there's more that can be done. The second thing is, generally I notice people are a little shy, right? This whole thing about accommodation that Jamie brought up, and I'm going to actually pivot it back to Jamie with this, is how do we make sure that it is okay to ask that because I am unique or all of us are unique, that we need this for us to succeed? And what that is going to be different for different people. And this is something even I struggle with when I have to say that for me to succeed, my environment needs to reflect this. I mean, I raised my two children working here at UTD, right? So I brought them along with me to my lab, to my office. I couldn't take them into my lab, but they've spent, so for them, the outing for them was going to UTD, which by the way has now gone away because they can't go anywhere. They have to be at home. But that's what their life has been. So building that support structure to help support, right? So I'm going to now pivot this to Jamie and say, hey, Jamie, help us. How is it that it's okay? How do we ask for accommodation? So for our unique needs without us feeling bad about asking for it?
I think you bring up a really good point in that it's about seeing people like you. And so, that's something where there is a stigma in medicine and even in research about, having a disability needing accommodations, having chronic illness that, may take you out of the lab for a while, that may, cause those breaks in your project. And I think a big part of it is seeing people like you, and then also having the information easily available. And, that's something that, recently when the NIH started to, be more inclusive of individuals with disabilities as part of diversity in science, I think a lot more attention was put to having that information freely available, that you didn't have to hunt for information on how to find accommodations, on how to apply for 504, of how to find the disability office, or, whatever it, I think ours is disability and inclusion or diversity and inclusion. And having access to that information and just, being able to search on the website and have a page that says, hey, we acknowledge that we're going to have students with disabilities, and this is what we do to support you. And then when you reach out to them, having somebody who is, not kind of giving you the deer in the headlight look at, because that has happened before where, I start talking about accommodations and they're like, we've never done this before. And so, having those people who are familiar with, what can be done to help students who need accommodations, and even having people for them to talk to, that's something that I reached out and started working with our office on, having some sort of support network or network of individuals who, people who had permission to, be connected with others who are going through the process, so that, as you said, seeing somebody else who's going through it, and then also just, kind of a more grassroots effort of talking to students, talking to people who might be going through something and say, hey, there's resources out there. is also another way to connect people with those resources and make them more open to pursuing them.
Very good. I have more questions. I'm sure that Dr. Prasad also have more, but before we continue with conversation among us, let's ask Enrica if audience has submitted any question. Let's give them a chance also to share their their questions with us, with Jamie especially.
Definitely, and I think possibly y'all have already discussed some of them. One question was posed to both Jamie and Dr. Prasad. Despite all the challenges that you faced, was there a singular moment or situation in your life, in your career, that reassured you that you were doing the right thing for you?
I can go ahead and answer that. And the time that really comes to mind, because I had a lot of doubts and was really struggling with whether or not I could do it. And it was actually in preparing for my candidacy exam that really solidified that my love for research and my love for delving into the literature and see what's happening. Because thankfully, and part of it was because of institutional policies and just kind of my own framework, I dedicated time to do that. And so I set aside time where I was purely focused on reading and writing and working on we do a written proposal, and I up until then, it was a struggle, but having that dedicated time to really sit down and focus on the science kind of reconnected me with why I, with my passion for research and why I did what I did. And that was really what solidified for me that, this is really what I want to do. All the struggles aside, all the other issues aside, which is unexpected because, candidacy is a very challenging time, but I actually ended up really enjoying it.
So for me, the decision point for the lowest, I would say, professionally was the time just before I joined UT Dallas, was to figure out whether I really wanted to do it. I was just as close to saying, okay, I'm going to maybe struggle through another year going to Kansas. As soon as my residency petition got approved, I'm going to find myself a corporate job, because then I'm no longer bound by the restriction of being in an academic job, and I'm done with this. Because, getting told over and over again that you're an imposter in science or in engineering is not a very nice feeling, right? So then when that offer from UTD came, because remember in the second year I didn't interview with UTD, it was my previous year's interview whereby Dr. Wildenthal was able to find the resources and make that offer through, of course, the Department of Bioengineering. So and the thing is, I really didn't expect them to give me tenure, because every time you change an academic job, you're asked to reprove yourself, right? Especially because I'd gone from a higher rank institution to a lower rank institution, now back to a higher ranked institution. This is the academic vagaries of life, right? Like, you've got to go with that. But Dean Spong then pretty much said, you know what? I mean, you've done more than enough. I'm going to put you up for promotion and tenure, so that you come in with tenure. So at that point, my husband said, look, this institution is doing this. So even though he was having a rock star career where he was at, so he had to redo his whole career, right? So restart pretty much for him. So there are, of course, on a day-to-day life, many pinch points where we think about what it could have been. It's not an easy road, so you'll have to redo it every single day at your personal level when you think about this, because The would have and could haves are many for both of us when we committed. But today, when I look at every student who graduates from my lab and every award that student wins, and every time their paper gets national recognition and international recognition, I feel I've done the right thing, because it is not my personal passion alone that's driving this. It is their combined passion. It's what we are able to build together, the ability to shape different students' lives in such a diverse portfolio of people that I'm getting to see. So that's probably where I see it today, every day, when I think of every student.
That's really an excellent point that Jamie and Shalini pointed out. You know, living as a graduate student and working toward your research and continue motivating yourself that this is the right kind of path that I chose for my future, for myself, and not give up, almost is a daily challenge, right? I mean, no matter if you are you have traveled across the world to come as an international student, living alone with a lot of challenges and difficulties, or you are with your parents and kind of maybe more resources are available to you. No matter what, the whole process is really a kind of investment. I mean, graduate students, I think in general, should realize that no matter what, this road has a lot of bumps. The best case scenario has a lot of bumps. Now, what keeps you motivated is, of course, your passion, your developing this passion. This is also not, a gene in your body, to the best of my knowledge, that, creates passion. And also be persistent and look at the kind of goal that you have going forward. That's very interesting.
Absolutely. To Jamie, firstly, but I would open this up to both of you. What advice would you give for balancing such a heavy workload?
I mean, a lot of it comes down to prioritize, and having to really, I had to kind of narrow down, even in my my volunteer activities, and learning to say no to certain things, and kind of centering my volunteer activities around things that contribute to both my medical education and my research education. So, for example, one thing I did say yes to was the Department of Defense medically directed research programs have consumer reviewers on their grant review panels. And so the Hydrocephalus Association nominated me to be a consumer reviewer. And so that was a great opportunity as a graduate student to sit on a grant review panel, to actually score grants and get experience in that. And so, that's something that thankfully, isn't too time consuming, because it's just once a year, and I knew would really contribute to my graduate education. And so prioritizing things like that. But then also, especially with my own experience, having to focus on your health and well-being. And it's something to definitely not put off or to put aside, because that contributes to your productivity. So if you're, excessively sleep deprived, if you aren't taking care of yourself, then you aren't going to be able to focus on, graduate school tasks and reading and, everything else that you have to do for that, and running experiments. And so it's very much a balancing act between the two. And then, also kind of being realistic. And so, for example, my first surgery of graduate school, I was like, oh yeah, I can be back in the lab next week. And, being realistic about, I'm going to need to take a little bit of time or focus on writing, or, and taking that time to rest and fully recover, because, when I didn't do that, that's when I noticed that kind of my productivity suffered. And so being realistic with your expectations of yourself and kind of what you plan to do with the amount of time you have.
So yeah, the other thing I would probably add to that is, finding the right team or hiring. For me, I'm looking at it, with of course, the lens also of perhaps managing a lab or managing a department. And then when I think about that, I do think it is the people who are around you. It is the team that makes you, right? Because if you hire people with passion and purpose, then you can get to where you need to get, much faster and much further along as well. So whether it is in my own department, when I think about all the staff who support all these activities, so we're just working to put our 10th year celebration out there, it is that passion that all of them brought into that project that drove it. If I wanted to do it all by myself, that's not going to happen. Same thing in the lab. Whether I recruit a graduate student, we think about how a person fits within that team and how they're good team players, because we know that team science and engineering requires us to partner with diverse in a knowledge base, as well as with diverse kinds of people, and understanding where they're coming from. So that helps us to do a lot more if we find the right partnerships and we are open to partnerships.
She identified 3 gentlemen who believed in you, Dr. Prasad, and were pivotal in helping you realize your career and professional goals, at least here at UTD. You mentioned the 3. How would you describe the role of men in making the STEM environment more supportive for women?
Yeah, so this is actually a very important question, right? Because it is not that women are working, it's not an either or problem. It is the collaborative that matters, right? So it is, in order for women to succeed, we need men to not just believe that we are the equal partners, but also they are also our advocates, right? To get that word out, because we are truly the yin and yang, right? So the ideas balance themselves out. So we need to have that partnership. So most of the time I realize it is not a lack of wanting to support or wanting to encourage women. It's even a lack of awareness of the problem that is there, right? So this is why I go back to that awareness and education piece. So for example, I'll take this whole idea that I had to use my breast pump in my break, and I would prefer to use it in my office because walking to that lily pad space was way too far out and I had a class right after. So it just didn't make practical sense. But of course, I had to tell my neighbor respectfully, I'm going to be doing this. So it took him aback. He said, okay, whatever is that, right? So then you have to explain the problem, and then you come at it, and then you say, oh, okay, then very respectfully, he made sure that nobody was there in the suite at that point of time, so that I got my time to do what I needed to do. It's a matter of educate, and yes, it's a little embarrassing. I can tell you that, to wanting to state certain things, but I've realized if you tell it and you explain it, then people are more willing to understand. It is truly about the awareness that we have to create, whatever is that problem. Once we do that, then they will advocate for you. That is what I have seen. It happened with my own department head, right? When Dr. Vidyasagar hired me, he said, okay, now that you have to go back and forth, do you just want to teach 1 day a week? So because my family hadn't yet moved till then, right? So I said, no, it doesn't make sense to the students. I still want to teach my Monday, Wednesday class. I don't want to teach just 1 day and burden them. But he was so understanding and supportive, right? So what do you need for you to succeed? So I think it's important that we educate, and make people aware. Yeah.
Jamie, would you like to add anything on your side about the STEM in general?
I think Dr. Prasad did a wonderful job about answering about how important it is to educate and advocate for yourself, because so much of it is education and, coming from the standpoint of accommodations and disabilities and chronic health issues and everything. There is a stigma, but if you can provide that education and say, hey, like I can still do everything I need to do, and this is what I bring to, to the field through my experience, I think that education is key.
Excellent. It was great, and excellent to hear your experience, Jamie and Shalini. Thank you very much for your time and talent and experience today, and you're talking with us. Jamie, we look forward. We already are quite proud of you as our alumni, but we are hoping also that you continue your successful journey in neurology path, and we hear more successful events in your life. Please keep us updated. Please stay in touch with UT Dallas, and hopefully we see each other in future events, either in Dallas, in other places, but we love to hear from alumni. I'd like also to thank Enrica and her team. It's a large team. Forgive me if I don't name one by one. You guys do excellent job for your outreach program. Same thing with alumni relationship program. I hope that these recordings become available to everyone, including our graduate and undergraduate students. And then, we see the audience again back in Comet Corner in future, and most likely in 3D, in person, rather than 2D virtual. That's my hope. I don't have anything else to add, Enrica. Please, I pass it to you, and wish everyone a good day.
I just wanted to say, Jamie, thank you very much. You talked a lot about passion with a purpose. So we are really happy to have you, join and interact with us. I hope to see you in person, sometime soon when we can all do that. And we are truly thankful that you took this time to spend with our Comets here at UTD. Thank you.
Thank you.
Thank you, Jamie, Dr. Nourani, and Dr. Prasad for your time, your talents, and your resources, sharing them with us today. Audience, thank you for joining us. Thank you, everyone, and have a great afternoon.